Thank you, Chris. Our next speaker is Marc Rodrigue. He is substituting for Brigitte, who is here. He is with bioMérieux. He has been with the company for 33 years in the Medical Diagnostic Discovery Department, and today he's going to be talking to us about Episeq, which is a next-generation sequencing service for infectious disease outbreak management.
Thank you. Good morning. Yes, I can confirm I'm not Brigitte, who is here. So my talk will be mainly dedicated to hospital-acquired infection, where we launched recently Episeq approach dealing with epidemiology by sequencing. So healthcare-associated infection, this is something which is quite universal. As you can see that over 4 million patients in Europe and close to 2 million patients in the US arose each year. More than 70% of each organisms causing hospital-acquired infection are resistant at least to one drugs. And this generates more than 7 billion per year in Europe to take care of this kind of infections. So it's very important to know what is occurring and how to manage this kind of infection. So why taking into account this kind of things? Because more than 30% of hospital-acquired infection can be preventable. And MRSA, Staphylococcus aureus, infection rate can be reduced if we can anticipate what is occurring. This is why bioMérieux today is launching Episeq service offer for Staphylococcus aureus, and then in the following months, more different species will be also available. So this is a partnership with Illumina. You probably all know that in December 2014, bioMérieux and Illumina signed an agreement and partnership on microbiology. And more recently, last December, we launched this offer on Staph sequencing. So what is the offer? The offer is mainly to give access to new generation sequencing to healthcare institution, hospital, public health service, in order to have accurate identification of the bugs occurring in this disease, a better understanding of the transmission, access to also information about virulum and resistome, which is quite important in terms of epidemiology and anticipation of treatment, as well as a perfect identification of the strain, ID card of the strain, in order to set up a phylogenetic tree. So just let us do the work for you. You just have to order the sequence, you send the specimen, we receive it, you will receive the report, and then you can decide how to treat and to act on the disease. How it works? Once you have an outbreak suspicion in the hospital, then you have to send the specimen, and we come back to this just after. You send it to service labs that have been selected by bioMérieux and Illumina, very dedicated and specialized lab, who are performing the sequencing with MySeq, and the reads are put in the cloud, and in the cloud, all the assembly and report are generated and will be sent to the person who orders the test, and then the clinicians can decide and act to resolve the infection. So, more in-depth protocol. As I said, we receive the sample. The sample can be petri dishes where the colony are present. It could be the sample itself, like with swabs or portagen. The second step is subculture if we receive the specimen, or DNA isolation if we have already the colony. Then library prep using Illumina kits, sequencing, and then the reads are going to the cloud. Maximum of 7 days is needed to have the results. So the pipeline of analysis, once we have the read, we make the assembly, marker detection and characterization, and then the phylogeny. It will give you access to confirmation of identification using 16S, typing, phylogeny, and annotation. And what is beyond that? A dedicated meta database for Staph aureus containing for each target a dedicated databases. The kind of report people are going to receive, it's really a summary. It's a confirmation of the identification of the species. Then you will have access to resistant markers with a summary of the markers, but if you are interested too, going more in depth, in details, to each kind of mechanism of resistance. But if you just have or want to have a summary in just one screen, you will have access to all the information, including the phylogenetic tree. So I encourage you to go to the dedicated website in order to have more information. And just by typing Episeq as a keyword, you can also have access to a YouTube video. So you will ask me, what else? Well, sorry, ladies, but George couldn't make it. Don't look around, he's not here. Even if I would be very surprised that he would have been of added value in this context. So we saw during these days that sample prep upstream of sequencing is a really key problem. So at bioMérieux today, we have already validated some protocols on swabs, colonies, urine, and bronchoalveolar lavage. And what is ongoing today, sputum, stools, and blood. Why trying to work on this kind of specimens? Because we intend to work also on metagenomic and microbiome. On metagenomic, we are already working on bronchoalveolar lavage, and we have a collaboration in place in Geneva, working on the ventilated acquired pneumonia. And preliminary results have been published last year during ECMID meeting. But it's not all, because the next to come is TB. We intend to work on TB sequencing, starting directly from smear-positive samples. And how we want to do that? Starting from the sputum, sample prep, as I said, which is key, sequencing, interpretation, and patient report with the ID and IST. So why working on TB drug resistance? Well, it has already been said during these days. Access to the information on all these known antibiotics, the 2 new drugs that have been launched recently, and the new drugs which are to come. I will borrow you with all these numbers, but just to, at the patient level, the duration of the treatment, the number of pills they have to take every day, and the cost of the treatment. But the cost of the treatment in US is also much more important. Just for one sensitive TB bugs, it's more than $15,000 US. For MDR TB, more than 100,000, and I just let you see for XDR TB. So, it means that treatment costs and access to knowledge for new drugs could justify sequencing pricing. And just an article that has been published by the Compass TB study group last year, where the conclusion were that whole genome sequencing could give access to results in 9 days, which means 21 days faster than current practices. In terms of cost, you can see that globally speaking, whole genome sequencing would be cheaper than culture antibiogram, with a 7% cost reduced regarding normal things. Of course, such cost today is quite high to be deployed in developed countries, but we saw yesterday that it could be much more cheaper. So we are confident that in the coming days, not days, but months or years, it would be available for developed countries. So I thank you for your attention, and I will be happy to answer some questions. Well, today I cannot answer because I'm not from a commercial operation, but just to give you an idea, typing a PFGE is around 100 euro, so it will be a little bit more, but well, it won't be the cost I show you for TB just recently, but it is probably in between. But if you are interested to, just ask to our commercial operations.
A similar question on the cost of the service in Europe, and if you can consider the possibility to have contracts with the institution. I'm actually responsible for the molecular typing of all nosocomial pathogen in my institution. So we type routinely about 600 pathogens that are responsible for outbreaks, or we suspect. We have a routine protocol for typing. And we are considering to move to the next generation sequencing because the cost for isolate for us is about 100 euro, will be. So my question is also, would you consider to receive data from other institutions that are doing typing in-house in order to have a global picture of the clones around Europe? Is that something that can be considered and added? Because the nosocomial picture of one hospital only doesn't help anybody. I mean, you need to be more global in order to be able to say something, because patients go and return from different institutions. Now they move across Europe because it's feasible, it's free.
Well, I cannot answer your question because I'm R&D guy.
It would be a very interesting aspect.
Yeah, but I think you can contact our commercial people, and technically speaking, it's feasible. Mm-hmm. Commercially speaking, you should ask them.
Okay.
Thank you. This is very interesting, and I would follow up with what Daniela was mentioning. I think the value of these approaches depends on how universal the coverage is, to know what other strains are circulating in the community. So, and to that point, if the person sends you something to be sequenced, do they, in addition to the results, gain access to the library to see how does that particular strain relate to others that you've read in your repository of information?
Yeah, because you have access to the phylogenetic tree, and then you have the comparison to the reference strain.
Thank you.
So thank you.